Bismillahirrahmanirrahim. Today we are going to talk about the hypothyroidism. Hypothyroidism is the underproduction of the thyroid hormones. We know that thyroid hormones are very important as they accelerate the basal metabolic rate of the body, and lacking thyroid hormones will result in hypothyroidism and its related consequences. While discussing the abnormalities of the thyroid gland and thyroid hormones, the three major pathological conditions are the hypothyroidism, which is under secretion of the thyroid hormones or lack of thyroid hormones, further divided when there is full-fledged hypothyroidism known as the overt hypothyroidism, and sometimes the patient may present with no symptoms, but what happens that the TSH level, which is the first line test for investigating a thyroid problem, will show a level of TSH that is above the defined levels. For example, 4.5 milli-international units per liter is the uh, range of the TSH, but if it is more than 4.5 milli-international units per liter but less than 10 milli-international units per liter, so in between these two range the patient is symptom free, the thyroid hormone levels in the blood is within normal limits, but the TSH is elevated above the defined range, and this condition is known as the subclinical hypothyroidism. The hyperthyroidism is the overactive thyroid gland, or by any reason the thyroid gland that produces excess thyroid hormones, and again it is divided into an full-fledged over hyperthyroidism and subclinical hyperthyroidism, in which the TSH is uh, below the defined range but the uh, thyroid hormone level is normal. Thyroid neoplasms are very important because many types of uh, cancerous conditions like papillary carcinoma, follicular carcinoma, and undifferentiated neoplasms, they occur in the thyroid glands. So, what is hypothyroidism? Hypothyroidism will result from any structural, that is, morphological or anatomical abnormality in the thyroid gland, are functional. If the thyroid gland is normal but it is not secreting the required amount of the thyroid hormones, so any structural or functional derangement which interferes with the production of adequate levels of thyroid hormones will turn the patient as hypothyroid, and this condition hypothyroidism is very common. We know that hypothyroidism may be the result of some problem in the thyroid gland itself, and that is known as the primary hypothyroidism. We know that thyroid gland is controlled by the anterior pituitary through thyroid stimulating hormone or thyrotropin, which is necessary to activate the anterior pituitary gland to cause T3 and T4 production and secretion. So if there is a problem in the pituitary and not in the thyroid, which is interfering with the thyroid hormone secretion, we say this is the secondary hypothyroidism. We also know that the pituitary gland itself is under the control of hypothalamus. The hypothalamus releases thyrotropin releasing hormone or factor, and it stimulates the anterior pituitary to cause secretion of TSH which in turn stimulate the thyroid gland to produce T3 and T4, the thyroid hormones. So the problem may be in the hypothalamus caused by any injury, the presence of a tumor and other pathological lesions, and it is not secreting the TRH. So the hypothyroidism, if it is due to problem in the thyroid, will be primary hypothyroidism. If it is due to the pituitary and hypothalamus, it will be secondary or tertiary hypothyroidism. Now coming to the causes of hypothyroidism, is I said we divide them into primary and secondary causes. In primary causes, we divide the primary causes of hypothyroidism into congenital and acquired. The congenital hypothyroidism will occur in the newborn, and it includes some developmental abnormalities during the embryonic life, in which there may be thyroid dysgenesis, failure of the development of the thyroid gland, or the gland may be normal, but there may be some genetic defect in the hormones and in the enzymes that control thyroid hormone synthesis. And in that situation, when the hormones or the enzymes are defective, there is no proper formation of the thyroid hormones, and this will stimulate the anterior pituitary to secrete excess TSH that will induce growth and growth of the thyroid gland and may result in dysharmonogenetic goiter. Now coming to the acquired conditions that causes hypothyroidism, worldwide iodine deficiency is the most common cause. We know that iodine is the essential component that is required for the formation of the thyroid hormones, as this iodine causes iodination of the amino acid tyrosine, and the thyroid hormones are the iodinated tyrosines. So iodine deficiency was there was a time when iodine deficiency was the first cause of hypothyroidism, particularly in the hilly areas where the soil and the water is deficient in iodine. Now after the iodine deficiency, the most common cause in the world, and particularly in those countries that properly use iodinated salt, and there is no iodine deficiency. So after the iodine deficiency, the most common cause of hypothyroidism is the autoimmune hypothyroidism, also known as the Hashimoto thyroiditis. In Hashimoto thyroiditis, which is an inflammatory condition, thyroiditis, which is an inflammatory condition, and what happens in Hashimoto thyroiditis, that the body immune reaction induce an autoimmune reaction in the thyroid gland, that the immune system consider the thyroid proteins as foreign, as normally it should not. So by considering the thyroid proteins as foreign, the immune system attacks the thyroid gland and destroys the follicular cells. So Hashimoto thyroiditis is the first cause of hypothyroidism in those areas and in those countries where there is no iodine deficiency. The third most common cause is the of the hypothyroidism is the post-ablative hypothyroidism. Sometimes we do surgery for some problem, for example, for a tumor, or for an enlarged thyroid goiter in case of hyperthyroidism, multinodular goiter, for an adenoma, or from any problem else. But during surgical removal of the thyroid gland, we remove so much excess thyroid gland that the remaining thyroid gland is unable to produce the required amounts of the thyroid hormones. The same is the situation that may be caused by radiation therapy. Particularly in hyperthyroidism, we give radioactive iodine. And the radioactive iodine may sometimes cause excess destruction of the thyroid gland. And there is no thyroid gland structure saved to produce the required amount of the thyroid hormones. Some drugs can also cause hypothyroidism by decreasing the production and secretion of the thyroid hormones, particularly when we use anti-thyroid drugs like thiazolamides in hyperthyroidism to decrease the formation of the thyroid hormones and to relieve the symptoms of hyperthyroidism. But sometimes these drugs have the potential to make the thyroid gland underactive. The secondary or central hypothyroidism is caused by tumors, diseases, injuries to the hypothalamus and anterior pituitary gland. And here the thyroid gland is normal, but the hormone production is not up to the requirement of the body, which is caused by lacking the TSH from the anterior pituitary that stimulate the thyroid gland or the TRH from the hypothalamus that stimulate the anterior pituitary to produce TSH. Now, hypothyroidism may occur in children or it may occur in adults. Both may lead to serious conditions, particularly in children. The hypothyroidism may be caused by some structural defect. For example, congenital lack of a thyroid gland which is not developed and that mostly develops at the 16th week of gestation, and this condition is known as the congenital cretinism, and the child is known as the cretin. And what happens in congenital cretinism, that there is failure of the physical growth of the body and also failure of the development of the brain and central nervous system, and this will lead to short stature due to failure of growth and mental retardation due to failure of the development of the brain and central nervous system. Sometimes the gland may be developed normally. The thyroid gland develops normally, but there is some genetic defect in an enzyme and hormone, for example, thyroid peroxidase enzyme, which causes oxidation of the iodide into elemental iodine, or sometimes there may be defect in deiodinases. So here there is no structural defect, but the defect lies in the enzyme. As a result, there is defective thyroid gland for production, and the child develops the hypothyroidism. Sometimes in some areas of the world there is iodine lack in the diet, and when the child is not getting the required amount of the iodine for the formation of the thyroid hormone, these childs develop cretinism, and this type of situation is known as the endemic cretinism. In the adult life, the development of hypothyroidism may be caused by thyroiditis, for which the Hashimoto thyroiditis, an autoimmune disorder, is the most important. And if the adult hypothyroidism goes into its severe form, it is known as the myxedema, because of the accumulation of the mucopolysaccharides or glycosaminoglycans in the skin, which becomes thickened and also the person becomes to develop slow reflexes, weight gain, constipation, and other symptoms associated with hypothyroidism. And in the most serious condition, the adult hypothyroid patient may develop the myxedema coma, which, if not treated, may be fatal. In this picture, we can see the congenital hypothyroidism, which the child may be having slow and sluggish reflexes, the excess growth of the tongue and umbilical hernia, and the failure of growth, abnormal growth, and abnormal facial appearance, and short stature, and mental retardation. In adult hypothyroidism, the symptoms that we are going to discuss in next slide, and in, in its most serious form, it may lead to myxedema coma. In hypothyroidism, the person is having very slow and sluggish responses, and most of the time patients of hypothyroidism are considered to be suffering from severe depression. These patients, they continually gain weight, and this is because of the decreased basal metabolic rate. The basal metabolic rate and the metabolic rate in the body is so decreased that there is no utilization of the carbohydrates, proteins, and particularly the fats. And as a result, the deposition of fats in the body causes the person to gain weight. Because of slow basal metabolic rate, the hypothyroid patient is very sensitive to cold. Since there is decreased heat production by the body, the person cannot tolerate cold. While in case of hyperthyroidism, the problem was intolerance to heat. But here in hypothyroidism, the problem is intolerance to cold. As we know that the thyroid hormones are very important for the stimulating the autonomic nervous system or sympathetic nervous system, and particularly it stimulates the cardiovascular system and central nervous system to the effects of catecholamines. So when there are no thyroid hormones or decreased thyroid hormones, what will happen? That the patient will be having a slower heart rate or bradycardia. His mental capabilities are slowed down. The patient is lethargic, uninterested, in feeling of something like lacking energy to do something. And due to the effects and slow motility of the gastrointestinal tract, the person will develop constipation. The myxedema, which is the accumulation of glycosaminoglycans and mucopolysaccharides, will cause swelling in the skin and soft tissues, particularly the tongue. A patient with myxedema may develop myxedema coma when the person is exposed to some sort of stress in the form of infection, or if the patient undergoes some sort of surgery. Goiter is the name of structurally enlarged thyroid. And in many thyroid problems, the thyroid gland enlarges and form a goiter. For example, in multinodular goiter, goiter associated with iodine deficiency, and in Hashimoto thyroiditis, which is an autoimmune condition in which the thyroid tissue is destroyed is may also initially uh, present in the form of a goiter. And this is because this is an initial attempt of the thyroid stimulating hormone from the anterior pituitary to cause increased thyroid hormone secretion by the gland and causing enlargement of the gland to uh, do excess thyroid hormone secretion. In congenital hypothyroidism, if the baby is in the uterus before 16th week of gestation, and if the mother is hypothyroid, and as the baby here is dependent on the mother thyroid hormones, so severe mental retardation and severe hypothyroidism can result. But after 16th week, even if the mother then becomes hypothyroid, but if the thyroid gland of the child has got developed, so mostly the uh, child doesn't suffer from hypothyroidism. This is very important because neonatal hypothyroidism is a very serious condition, and if it is not diagnosed and not properly treated uh, uh, at the earliest stages, it may lead to severe mental and physical abnormalities in the child. And for this reason, in most developed countries, the newborn babies are screened for congenital hypothyroidism. Because if the hypothyroidism is not treated, as we know, thyroid hormones are very important for physical and mental growth. So these children, they will suffer from intellectual disabilities, delayed physical growth, and cretinism, short stature with defective physical and intellectual growth. So the symptom of hypothyroidism may be the patient is feeling tired, unable to do anything, feeling severe cold, slow heart rate, weight gain, feelings of depression. Most of the hypothyroid patients, adult hypothyroid patients, will be seen in the clinics of the psychiatrists. There is defective hair growth, and due to accumulation of the glycosaminoglycans and mucopolysaccharides in the soft tissues and in the tongue, there will be enlargement of the tongue, and the patient may have a hoarse voice, and due to decreased motility of the gastrointestinal tract, the patient develops constipation. Thyroiditis is diabetes, inflammation of the thyroid gland. So inflammation of the thyroid gland, the three most important causes of the inflammation of the thyroid gland and thyroiditis, one is the autoimmune Hashimoto thyroiditis. The two other conditions are transient conditions, and one is known subacute painful thyroiditis. And it is also known as granulomatous thyroiditis. And in this condition, the thyroid gland becomes acutely inflamed. It is tender, and mostly the patient are considered to be having some dental problem, or having some infection in the air, or they may be mistaken for tonsillitis. But the actual disease is the viral infection of the thyroid gland. Now, what happens that in subacute painful thyroiditis, initially there is a stage of thyrotoxicosis in which there is release of preformed hormones from the thyroid gland. However, later on, the thyroid hormones become deficient and the patient may go into the hypothyroidism. This condition is mostly self-limited, and after the infection is over, the thyroid function test will return to normal. The other form of inflammation of the thyroid gland is the subacute painless thyroiditis. In this viral granulomatous thyroiditis, the condition was painful, but in painless thyroiditis, also known as the lymphocytic thyroiditis, this is commonly a condition that occurs in female after she has given birth to the child. And mostly in the thyroid gland, there is infiltration of lymphocytes that favor that the lymphocytic thyroiditis is an autoimmune type of reaction because there is excess infiltration of lymphocytes. It is painless, and this usually happens in the postpartum period of the female after childbirth, and mostly the condition resolves after some time. And in both subacute conditions, initially there is hyperthyroidism due to the release of preformed hormones from the thyroid follicles, and this situation will be followed by lacking thyroid hormones or hypothyroidism. And when the disease is over, the thyroid may turn normal. However, some patients, a very few patients in these two conditions of the inflammation of the thyroid gland may become hypothyroid permanently and will need thyroxine replacement therapy for the rest of their life. As I said, Hashimoto thyroiditis, the two diseases at the extremes of the functional disorders of the thyroid gland. In hyperthyroidism, the autoimmune disease is the gravest disease. And at the other end of the parameter, in hypothyroidism, there is another autoimmune disease which is known as the Hashimoto thyroiditis. And here, the immune system consider the thyroid proteins as foreign and develops an immune reaction against the thyroid proteins. As what happens in routine, the thyroid antigens are presented by the antigen presenting cells to the T cells, and the T cells, they then release cytokines like interferon gamma and tumor necrotic factor that cause destruction of the thyroid cells. Moreover, the CD8 positive cytotoxic T cells, they are also involved in the destruction of the thyroid glands, and the autoimmune reaction and the antigen presenting cells also activate the B lymphocytes that are converted into plasma cells, and they secrete antibodies, particularly the anti-thyroid peroxidase antibodies and the anti-thyroglobulin antibodies, and they cause antibody mediated destruction of the thyroid gland. Initially, when there is lack of a part of the thyroid gland with the existing healthy part that is still not destroyed by the autoimmune reaction, what happens that low level of thyroid hormones will stimulate the anterior pituitary and hypothalamus to increase the secretion of TSH, and this TSH may induce enlargement of the thyroid gland, and there may be release of excess thyroid hormone, mostly the preformed thyroid hormones present in the thyroid gland, and that may cause a mild and transient stage of hyperthyroidism, and later on when the immune system destroys the whole of the thyroid gland, ultimately the patient goes into a state of hypothyroidism, and mostly the thyroid glands show infiltration of mononuclear cells, lymphocytes, plasma cells, and ultimately it becomes undergo fibrosis and become uh, the gland is fibrosed, small in size, and no production of the thyroid hormones. This immune destruction of the thyroid gland will cause hypothyroidism, and mostly these patients then will take hormone replacement therapy in the form of thyroxine for their lifetime. Some important points related to the Hashimoto thyroiditis is that this is the most common type and the most common cause after iodine deficiency. And people, as is true about any endocrine disorder, patient with one autoimmune condition may have another autoimmune condition too, and therefore these patients should be investigated for the presence of other autoimmune condition like diabetes, uh, hypoadrenalism, and like pernicious anemia, rheumatoid arthritis, and systemic lupus erythematosus. Typically, Hashimoto thyroiditis, the typical presentation is in the form of an older female. The disease occurs more in females than males. However, the disease may occur at any age, and even children may be affected. The people with Hashimoto thyroiditis mostly the these patients are to be investigated for other autoimmune disorders and certain chromosomal abnormalities. For example, the Down syndrome or trisomy, Turner syndrome, and Klinefelter syndrome, these patients of these chromosomal abnormalities may also develop hypothyroidism. Now, if we suspect that a person is suffering from hypothyroidism, we will do measurement of the TSH, thyroid stimulating hormone. If it is normal, nothing more to do. But if it is below the defined range, this indicate hyperthyroidism, and we will go in that line. But if it is more than 5.5 milli-international units, then this is hypothyroidism. So after measuring the TSH, then we measure the free T4. If the free T4 is also increased and if it is more than normal, then this is secondary hypothyroidism. While if in the face of increased TSH, still the free T4 level is less than normal, this means that the problem is in the thyroid gland. Here both TSH and T4 are increased, and we can say that the increase in the T4 is due to excess secretion of the TSH from the anterior pituitary, or problem may be in the hypothalamus. But in hypothyroidism, there is increase in thyroid hormone levels, particularly thyroxine, in the face of there is decreased thyroxine or free T4, decreased free T4 in the face of increased TSH. And if the TSH is increased above the defined range, but the free T4 is normal, this means that this person is having subclinical hypothyroidism. Patient with hypothyroidism but no symptoms. And the increased TSH has maintained the normal level of free T4, and this patient is at risk of developing overt hypothyroidism, in which the TSH level will go above 10 milli-international units per liter. So the TSH level will be elevated in hypothyroidism, which is the first line test. The T4 and free T4 are reduced. And if we find thyroid peroxidase antibodies in the serum of the patient, this will favor Hashimoto thyroiditis. And if TSH is reduced or normal in the presence of a low T4, when T4 is low and TSH is low and T4 is also low, or if the TSH is increased with an increase in T4, in this situation the pituitary function should be evaluated, because the problem may be in the pituitary. For example, if it is not producing TSH, automatically there will be less production of free T4. So, and if it is producing excess TSH, it will lead to excess production of T4. So, the problem should be the pituitary gland and pituitary hypothalamic functions should be evaluated. So, subclinical hypothyroidism is the condition in which elevated TSH but normal T4 and free T4, which are maintained at the expense of the elevated TSH. There are no specific symptoms, and the uh, thyroid hormone level is maintained at the expense of uh, elevated TSH level, and if thyroid peroxidase antibodies are present, then it favors Hashimoto thyroiditis. Normal level of the thyroid hormone in subclinical level, in subclinical hypothyroidism, it is in between 5.5 to 10, but below 10 milli-international units. And if the level of the TSH is above 10 milli-international units, this is full-fledged overt hypothyroidism. The sick euthyroid syndrome, in which there is deranged level of the T4 and T3 in extrathyroidal diseases. Particularly here, the thyroid gland is normal, but the low serum T4 is due to abnormality of in the binding of the thyroid hormones to serum proteins. As we know that thyroid hormones are carried in the serum by binding to the serum proteins, particularly the thyroglobulin, albumin, and prealbumin. So the problem here is not in the thyroid, but due to some problem in the serum proteins. And also in extrathyroidal diseases and in sick euthyroid syndrome, there may be reduced conversion of T4 to T3. We know that T3 is the active hormone, and the T4 or thyroxine should be converted by the deiodinases to T3, triiodothyronine, before it can efficiently exert its effect. In sick euthyroid hormones, the TSH is normal, and clinically the patient doesn't suffer from any thyroid related symptoms, and when the extrathyroidal illness is over, the thyroid function test after some time returns to normal. So in severe extrathyroidal diseases, the abnormal thyroid function test should not be considered to be due to some problem in the thyroid gland. After hypothyroidism, for example, when the gland becomes fibrotic, which may also be caused by another type of fibrosing thyroiditis known as the renal thyroiditis. But once the gland is unable to produce thyroid hormones, the patient will take thyroxine, synthetic thyroid hormones, for the lifetime. The dose starts from 50 microgram. Usually at 150 microgram, the patient is relieved of symptoms, and the compliance and adequacy of the dose will be checked by regular measurement of the thyroid stimulating hormone. If the TSH is reduced much, then the dose should be of the thyroxine should be reduced. And if the dose is unable to cause a decrease in the TSH, then the dose may be gradually increased, and the aim is to maintain the TSH in the normal range. Thank you very much.